Greetings, I'm Jennifer Kennedy, the lead for quality at CHAP, and welcome to this month's CHAPcast. Today, we've got a good one for you. It's a twofer. I'm joined by Katie Wehri from NAHC and Judi Lund Person from NHPCO, and we're going to talk about the end of the COVID-19 PHE and what that means for both home health and hospice providers. So welcome, Katie and Judi. I think let's go ahead and start off with some introductions. So, Katie, could you introduce yourself to the listeners and tell them a little bit about what you do at NAHC?
Sure. Thanks, Jennifer. I'm really glad to be here again with all of you. And I am Katie Wehri, the Director of Home Health and Hospice Regulatory Affairs at NAHC. I work, as my title indicates, on the regulatory side, dealing with all the rules and regulations that home health and hospice agencies have to deal with on a daily basis. And my background is in operations and implementation of those regulations.
Thanks, Katie. And we're going to task you mainly with home health today, but, jump in if you have your hospice as well, in terms of your expertise. So please jump in if you have any extra things to say. And our second of the twofer is Judi. So Judi, why don't you go ahead and introduce yourself and tell us a little bit about what you do at NHPCO.
Okay. Thank you, Jennifer. It's so glad to be with you today. I am Judi Lund Person, Vice President for Regulatory and Compliance at NHPCO, and I am focused exclusively on hospice and palliative care issues, regulatory issues, compliance issues, and tracking all of them and making suggestions for implementation and kind of translating regulations into plain English. So that's kind of where we are at this point, and look forward to the conversation.
Well, thank you both for being here today. Having two national representatives is huge when we're talking about wrapping up 3 years. Oh my gosh, 3 years of a global pandemic and so many changes and workarounds that both home health and hospice providers had to put into place in order to be in operation every day to see their patients and provide quality of care. So I guess my first thing that I would like to touch on is what waivers are going away by the end of the PHE on May 11th of 2023. And let's go ahead and start with hospice.
Sure. There are 3 waivers that will end at the end of the public health emergency. That is that waiver for additional time for the hospice comprehensive assessment. It'll go back to every 14 days from 21 days, which we had extra time during the PHE. The second one is the waiver of non-core services, and this would be PT/OT speech in particular. That waiver for not having to provide non-core services will go away at the end of the PHE. And then the third one is both for home health and for hospice, the hospice quality assessment and performance improvement regulation that is at 41858, or we more often, and Jennifer knows this best, we more often call it QAPI. And this waiver was to narrow the scope of the QAPI program, just to concentrate on infection control and adverse events. So that waiver will also go away at the end of the public health emergency.
So Katie, let's start with the QAPI. Is that similar to home health as well as hospice about having that infection control focus?
Yes, it's the exact same on the home health side as it is for hospice, which makes it easy for providers to remember. Things do get different and a little harder to follow on some of the other waivers under home health. When you ask about what waivers are ending, I kind of look at it as most all of the waivers are actually ending, so that providers will not be able to continue to have some of the changes that they did during the pandemic in terms of things like not doing aid supervisory visits, for instance. So the waiver ends, but there are some transition periods that CMS has allowed for folks to come into compliance, full compliance with the applicable requirement that is associated with the waiver. So, for instance, as I'm thinking about home health, I think about some of the situations where there are, 60 days after the end of the waiver to come into compliance, for instance. And I'm trying to think of what one of those would be. Actually, I'm taking a look here right now. One would be on annual on-site supervisory visits for each aide that's providing services. So again, the waiver ends with the PHE, but those visits that did not get done in these past couple of years do need to be completed, but the home health agency has until July 10th to complete those. So I think there is a distinction between, does the waiver end versus am I allowed to continue the waiver, or is there a transition period where I have to come into full compliance?
Yeah, it sure does. Sense. And, we did see some guidance come out on May 1st from CMS that, ran through the, provider by provider, some of those waivers. Are they going to be done on the 11th? Are they going to pull over? So I think I hear you saying, Katie, when you're talking about transition, some of those, at least in that memo, looked to me like they were going to be, in transition rather than a hard stop. Is that fair to say?
Right. And we're really pleased about that. Give agencies an opportunity to get back to where they were pre-pandemic, because in some situations, organizations have really used those waivers and have gotten really used to that over the past 3 years. And now it's time to transition back. And there's not that hard stop, which does make things flow a little bit easier from the operations side.
So let's go back to, let's do hospice and home health, but we'll start with Judi. Is when we talk about some of those things that are going to stick around for a little bit longer, like, I don't know, face-to-face, let's talk about some of those things that providers do have a little bit of leeway, as it were, until they refer back to pre-pandemic compliance. So what do those things look like for hospice, Judi?
Well, and I guess, Katie, I was sort of thinking about the 60 days after May 11th, or the 90 days after May 11th, or the end of the year after May 11th, as things that are kind of in flux. And I think your word about transition is a really good one. But Jennifer, let's start with the hospice face-to-face encounter. And we have been working really hard to make sure that providers know that that is a statutory change. And the hospice face-to-face encounter to be done through telehealth, that would be audio and visual, has been extended until the end of 2024. So it's 12/31/2024. And it was a part of the package of telehealth requirements that made its way through the Congress last year and ended up being part of the omnibus budget package at the very end of last year. So we're very, very happy to see that in place for another, almost more than a year and a half. Do you want to talk a little bit more about the things that are kind of hanging around, but not quite, not quite done yet?
Yeah, let's do that. Katie, go ahead.
Actually,
let's hear
Judi,
your thoughts on that.
Yeah,
I was going to jump back to that telehealth piece for just a minute on the face-to-face, and the same is true for home health. We have until December 31st, 2024 now for that. But there was some concern that HIPAA, the Office of Civil Rights, would not actually continue with some of the HIPAA flexibilities that actually allowed the face-to-face to occur with the patient. So that has been decided. OCR actually released some information that until December 31st again, 2024, they're going to match that with their enforcement discretion. So organizations who are using platform like Zoom for healthcare, they have a business associate agreement with the company running the platform for privacy and security, should be fine. but you do want to make sure that you're taking a look at what platform you are using.
Yeah, Katie, I'm glad you brought that up because that HIPAA piece is really key, isn't it? When we're talking about some of the extensions that are in place, and then once we get to that point where the HIPAA extension runs out, then we're going to refer back to we'll call it, my husband, who's a disaster guy, is he likes to call it in peacetime, when we're not in any kind of active emergency, where, you're going to have those HIPAA flexibilities apply event by event and only for the extent that CMS allows that event to go. So, thank you for bringing that up, because I was hoping one of you would talk about the HIPAification piece here, for sure.
HIPAification. I like that term.
Yeah, HIPAification that's a great term. I love that.
Any other thoughts on anything that is being extended? And also, you brought up a really interesting point about providers. Maybe they've gotten comfortable, or some have even gotten complacent with some of these waivers being in place for such a long period of time. What are both your thoughts on that?
I think providers have gotten to the point where maybe some employees who were hired during the pandemic know nothing different than what the pandemic requirements are. So I think that's the place where hospices and, Katie, home health agencies, but I think we're going to have to be very careful to make sure that we are not sort of sitting back and resting on our laurels, if you will, because I think this is, we're going to have to go back to pre-pandemic requirements.
Absolutely. And I think where agencies need to maybe refresh themselves on what the requirements are is related to the aides, supervision of aides, the 12-hour training, those types of things. And for home health in particular, I'm a little concerned about agencies forgetting the requirement about the initial and comprehensive assessment and how that works after the pandemic. So we originally had this waiver that allowed for any of the rehab professionals, OT, PT, or speech, to perform the initial and comprehensive assessment for all patients who were receiving therapy services as part of the plan of care. And of course, that was dependent upon state requirements as well. And then in the 2022 home health final rule, CMS finalized changes to permanently allow the OTs to conduct the initial and comprehensive assessment only in certain circumstances. So therapy will have to be ordered. It would have to be a therapy only case after the pandemic. If nursing is ordered, the OTs and other therapists are not going to be able to do those initial and comprehensive assessments. Now, NAHC is concerned about that. We actually submitted a letter and requested that CMS make some changes there, because this is just a requirement that doesn't make a whole lot of sense. Therapists are able to conduct initial and comprehensive assessments when therapy only is there. And when nursing then gets involved, what really should happen is looking at the needs of the patient, and the most appropriate professional should be conducting the initial and comprehensive assessments. So that's something that NAHC is asking CMS to change. But that's one area that I'm a little concerned about for home health agencies. Don't want them to get tripped up on that one in particular.
Yeah. And I think there are a couple of things on the hospice side that are extraordinarily exciting. Well, maybe exciting in the regulatory environment and not beyond that. But I think we have the question that lots of providers have asked about the hospice waiver for hospice volunteers, and we do now have a final answer on that. The final answer was published in the May 1st guidance, so just hot off the press, that CMS waived that requirement for meeting the 5%, and they have now said that that requirement will not come into play again until the end of the calendar year, so December 31, 2023. So translated, That is something where the hospice will have some time to get volunteers up and back in their program, because the calculation, that 5% calculation of staff versus volunteer hours, will not need to be done until December 31,
I'm sure that,
2023.
I'm sure that very helpful, very helpful for that.
Yeah.
Well, one thing I read in that
Absolutely.
memo that came out on Monday, and I'm sure lots of providers are going to be happy, that staff no longer will have to be COVID vaccinated. So, I mean, that has just been
Right.
something that I've heard over the last, year at least, about, oh my gosh, do we do this? What the exemption is for this? So that's not going to be
Right.
anything that will carry forward. But Katie, you mentioned, but I think both of you mentioned about the QAPI focus on infection control. That doesn't mean organizations have to completely, oh, all right, we don't have to really focus on infection control anymore. I mean, I think that's become part of the new fabric, if you will, of providing care. And if organizations want to look at what kind of policies they write for requirements, if they want to continue to have staff vaccinated, that'll be on their own policy, that they can do that as part of their infection control program. But I know that probably a lot of providers are going to be happy about that, because it was a hard lift when we're talking about having all of their staff vaccinated, for sure.
Right. I do think they need to check locally. Some states may be taking a different look at that. We don't know yet, but that's an area that they want to look at locally.
Yeah, that's
also
a great point.
So, and I think one other thing is that we are still waiting for the official, if you will, air quotes, guidance from CMS on exactly what the requirement is, or requirement will be lifted for staff vaccinations. The White House came out with their announcement, and then said, CMS will let Medicare certified providers know what the plan is by the end of the public health emergency. Well, it's next week, so hopefully we'll have something in our plan for getting that information out as quickly as possible.
There was a bit of a teaser in that paragraph in the memo.
There was.
So
yeah,
let's go ahead and when we're finishing up our discussion about pandemic going away, waivers going away, going back to I don't like to say pre-pandemic, because it's a whole different game now. We had what it was before COVID and whatever it is post-COVID. What do you think are going to be continuing challenges for home health and hospice providers? So, Katie, let's start with you.
Well, like I mentioned, kind of remembering what we need to comply with and refreshing ourselves on what the regulations are is going to be important, and making sure that we don't make assumptions. So we have put together actually a table that lays out the waiver, the current status of the waiver, and then the date that everybody needs to be compliant by. And I think that would be an exercise that's really helpful for organizations to go through, or find a table from NAHC or others who have put tables out, and just make sure that you really know what waivers are ending, if there's transition periods involved there, and also taking a look at what's happening in your state, because some states over the course of the past couple of years have made some changes permanently to, say, their licensure requirements or something like that. So you want to make sure that you know what you need to comply with, and lay out a timeline, that you don't have to be compliant with the 5% level of activity until, say, 12/31 of this year, but you're going to need to be working up to that.
Right.
So what is your plan to do that? So lay out your timeline, lay out your plan, and just make sure that you know exactly what you need to be doing when you need to be doing it. Excuse me. Sorry.
Yeah, that's a great point. It's almost like project management and planning to get to your goal. Well, that's good performance improvement as well. How about from the hospice side, Judi? Oh, I'm sorry, Katie, go ahead.
take a look at emergency preparedness too, because,
Right.
you know, you mentioned that memo that came out, and there are some requirements there even for hospices with inpatient units, which I'm sure Judi will
Oh
will
my
talk
God,
a little bit
emergency
about
preparedness. That's
also.
a whole nother podcast, Katie.
I know.
It is a whole nother podcast, absolutely. And we know you can be the greatest leader for that, Jennifer. So I did want to talk, I agree entirely with making sure that hospices are ready for kind of what pre-pandemic looked like. And I think a lot of providers are paying special attention to those newer employees who might not have ever known what the pre-pandemic requirements were. NHPCO has also put out a chart with kind of what the deadlines are for the various components of the hospice waivers, and I think that will be something everybody should be referring to. I guess the other thing I wanted just for a minute to talk about is it's a waiver, yes, but it's also an exciting recent announcement from CMS, and that is around routine home care being able to be provided through telehealth. And we know in the waivers that CMS has said that the waiver for to allow telehealth for routine home care will expire on May the 11th. However, both on a podcast on a CMS national stakeholder call last week, we heard from CMS that here, and I want to read it because I think it'll be really helpful to providers. So CMS said, after the end of the COVID-19 public health emergency, the expectation is that routine home care hospice services will be provided in person. Now, here is where the information gets exciting. There is nothing precluding hospices from using technology to have follow-up communication with the patient and the family, as long as the use of such technology does not replace an in-person visit. Additionally, such follow-up contacts should be documented in the hospice medical record, similar to the way telephone calls would be documented, and in accordance with the standards of practice and the hospice's own policies and procedures. This does not impact the use of telehealth for face-to-face, which we already have talked about. And then we have said NHPCO recommends reviewing and updating your telehealth policies to comply with post-PHE standards. And Katie, to your point, that also will include the Office of Civil Rights requirements for HIPAA compliance as well. So really, really glad we finally have some answers around what a hospice can do around telehealth after the public health emergency is over.
That got very confusing during that time, unnecessarily. So,
completely. For such a long time.
It's been a tough time, but anytime we can actually move forward a little bit, and I think there are a couple of good things that have come out of this pandemic that will help providers, both home health and hospice, be able to care for their patients in today's world in a better way. And Katie, it looks like you wanted to add a few things.
No, I was just going to say, as you're talking about how things have changed with the pandemic, I think that it's a positive that CMS is recognizing telecommunications, and especially in home health and in hospice. I was really hoping that we would see in the hospice proposed rule that CMS was going to gather some data about telehealth visits. And they didn't do that. Now they're doing that in home health, which I'm thrilled about. We have those 3 codes that go on the claim for home health, still not payable, but certainly a good step and a step in the right direction to have the codes so that CMS can gather some data and learn a little bit more about how telecommunications are used. It's one of the positives, I think, that's come out of everything we've been through the past couple of years.
Hopefully that will trickle on down to hospice at some point. I always think about hospice as the caboose on the Medicare train. Eventually all things come to it, right?
Right, exactly.
Well, I want to thank you both for joining the podcast today. And I wanted to ask you, any closing thoughts that you have for our listeners?
So I think from NHPCO's perspective, certainly paying attention to what the requirements were pre-pandemic, paying attention to the couple of things that became permanent, transitioning from waivers into permanent in the COPs, and also make use of the educational resources and other compliance guides and all of that NHPCO
Thanks,
offers.
Judi.
And I would echo Judy's comments. I encourage also organizations to think about, the pandemic as sort of the necessity that fostered some innovation within your organization, and to keep that spirit flowing and going forward, because I think we have improved in some ways. As difficult as it was, it did make us stronger in
Katie,
some ways.
you read my mind about the innovation piece, because I think it forced organizations to think out of the box, be more nimble and more creative about how they deliver care. So I agree with you. I would hope that piece would carry forth down the line. All right.
Absolutely.
Well, I was thinking about today's discussion, and I found this really great quote. A hero is an ordinary individual who finds the strength to persevere and endure in the spite of overwhelming obstacles. And that was Christopher Reeve, who said that quote. And it really, I think, fits what healthcare providers have been through during this whole pandemic. And yes, all of them who kept going out there, doing visits in the most creative ways and providing care, whether it was visit or telehealth or just being there for those people in need, are all truly heroes. So I felt like that really summed up our conversation today. So from the CHAP team and myself, I want to thank you for taking time out of your day to plug into our CHAPcast. I certainly learned a lot today from our two national leaders, and hopefully you did too. So stay safe and well, and thanks for all you do.